lately, I noticed that some people get pissed when you tell them to go to the hospital. They forget that not everyone that wears a lab coat is a doctor. The truth is, there are different medical professions and they have different responsibilities. The person you are sending those questions to may not really know the correct treatment plan for you. Sometimes you really need to go for assessment, you need to run some tests, you need to be checked, you need to carry out some ultrasound, or you need to carry out some x-rays or some imaging that will be able to show what exactly is wrong with you. Let's say the person you are sending those messages to is a nurse. And because of the years of experience that person have, the person will be able to have an idea about what is wrong with you. For most of the time, what people do is trial and error because we're not trained to do that. Some people go as far as recommending some injections and they end up administering those injections to those patients. At the end of the day, they may damage some nerves or leave them with some complications that they will regret for the rest of their lives. I've seen people who had to amputate their leg or go through series of surgeries because one of their nerves was affected when giving injections. I'm not saying it cannot happen when a nurse is administering it to you, but it rarely happens when a registered nurse is giving it to you. Everybody has his function. Doctor is there to analyze your symptoms, to prescribe drugs for you, to interpret your test results. The pharmacist is there to dispense the drugs that has been prescribed by your doctor. The pharmacist is there to give you basic information about the drugs that has been prescribed. The pharmacist is there to check if there's any drug therapy problem like overdose, like underdose. The pharmacist is there to compound. The nurse is there to administer the drugs. He or she is there to also check your vitals. He or she is there for your wound dressing. He or she is there for your nursing care. And then the medical lab scientist is there to carry out tests on your specimen, which could be your blood, your urine. It can be anything. And when the result is out, it will be interpreted by a doctor. Everybody has his own route. So don't risk your life. Please go to the hospital where every professional is there to look into your matter. So send this video to someone out there so that the person will not get pissed when he or she is sent to the hospital.